paper, and it's a pilot paper done by a group that does extensive amount of work on luteal phase support. And what they looked at is, do endometriosis patients require more progesterone? If you look at a paper of 262 patients on HRT therapy, 179 were diagnosed as having endometriosis. And these were given a pre-treatment and initially had a pre-treatment while they were being stimulated and a washout period, after which embryos were frozen, and the frozen transfer was with estrogen and exogenous progesterone, 90 milligram twice a day, and 4 days after, a day before embryo transfer, injectable progesterone of 50 milligram. And what did they notice there? And they noticed that the pregnancy rates were significantly affected by progesterone levels. Now, what we do know is that in cases of endometriosis, there seems to be a decline in live birth rates. So you're looking at lower ovarian sensitivity, lower oocyte yield, you're looking at impaired oocyte quality, effect of endometriosis on the endometrium, and also a higher miscarriage rate. So when was the progesterone done? Progesterone was done around day 9 or day 11 during that time after the embryo transfer. So it was done at a much later time. And what did they notice? They noticed, if you look at their studies, they noticed that if the progesterone level was kept at 118 nanomole per liter, live birth rates when they crossed 118 were 51%, and when they did not cross 118 was 34%. Now the question you would ask is, why was it kept at 118 when in normal frozen transfers, the cutoff often is kept between 32 and 60. And that's the cutoff which we keep in a normal cycle. So what is it that made this level go up? One is that we know that endometriosis has an anti-progesterone effect, and there has been a progesterone resistance seen in endometriosis. And what this study may be demonstrating is that by increasing the bar of endometriosis to 118 nanomole at a much higher level, below this, you're still seeing a lower pregnancy rate. Also, you're seeing a much higher pregnancy loss. And when you look at this, the picture, the pregnancy loss was almost 41% in the cases of a level less than 118. Now, what we also know that in this entire program is that endometriosis, and mainly estrogen endometriosis, is more of an inflammatory substance. Estrogen causes more inflammation in endometriosis. Progesterone does the opposite. Progesterone protects the endometriosis and suppresses it, and also has a more immunomodulator effect. Now, compare this to an early paper by Ziegler, and what he did is he gave estrogen or a pill suppression for 4 to 5 weeks. And what he was trying to do is to suppress the estrogen markers, suppress the inflammatory markers. And what he noticed is that those who were pre-treated had a higher chance of pregnancy, almost 47% compared to that who were not treated. Again, the one paper, but it may be throwing light. So what does this paper tell us? The paper is quite unique, and it's the first paper to look at endometriosis. It keeps the bar higher, and it's telling us that even with a higher bar of progesterone, and even with injectable progesterone, you're going to see a slightly lower chance of pregnancy when it is less than 118. And so what do I take from this paper? I take from this paper is, do we keep the higher progesterone levels in case of endometriosis by increasing the amount of progesterone we give? Now, what is the problem with giving vaginal progesterone? Its replication on serum progesterone is much lower, and it's not as good as the serum progesterone levels when you give vaginal. But also, giving blood progesterone and increasing it doesn't replicate and give you a better idea of progesterone inside the uterine cavity. And we know that from ERA tests. So we are in a bit of a fix here. But again, here what I would be thinking about is, one, to negate the aspect of a fresh transfer. That's my personal opinion, I tend to freeze embryos, but equally, when I do a frozen transfer, I tend to cross the 100 nanomole mark in almost all my cases of frozen transfer, including that of endometriosis. And that is something which we may be thinking of in the future. Thank you.